Hi, so this is a single case study looking at changing to local herbs with similar actions and indications. In this case, specifically for weight loss in a 65-year-old woman. This particular person, like I said, had some issues with weight and was having difficulty losing that weight. Previously started using perilla leaf granules and berberine extracted from Berberis aristata, which was grown in the Himalayas to help with the weight loss. Shortly after we started working together, she changed to perilla leaves rather than the granules. Perilla leaf is used to treat different infections. It has antibacterial properties, antioxidant, and anti-allergenic properties. And fresh leaves are often cooked with seafood to prevent food poisoning. It also helps with depression, cold, cough, vomiting, abdominal pain, and constipation. And there's evidence for anti-diabetic effects. The actual seed contains protein. It contains a variety of amino acids, including valine, leucine, isoleucine, lysine, tryptophan, threonine, tyrosine, phenylalanine, cysteine, methionine, histidine, aspartate, serine, glutamate, and proline. It also includes a bunch of polyphenols. Berberis aristata is antibacterial, antipyretic, antidiarrheal, antipyretic, anti-cancer, and anti-diabetic, as well as diaphoretic, and used in the treatment of ophthalmic infections. So you can see how there's a balancing of blood sugar aspect in both of these cases. Berberis aristata is also, quote, the leaves are reported to be used in hepatobiliary disorders. The berries, along with other plant-based ingredients, have shown cholesterolemic, effects in rabbits. And the plant contains isoquinoline alkaloids, out of which berberine is a major bioactive constituent. They have fairly broad effects on the digestive system. So they're going to change how food is digested, how it's absorbed, which will have an impact on weight. Berberine, again, the main extract from Berberis aristata, has been shown to regulate glucose and lipid metabolism in vitro and in vivo both. It's shown decreases in hemoglobin A1C to a significant level, as well as significant change in fasting blood glucose, specifically decrease, and a significant decrease in postprandial blood glucose. So it's having a direct impact on sugar absorption. Berberine also showed a significant change in plasma triglycerides in research, lowered FBG and PBG by 1 weekend, and was continued to the end of that specific trial. And again, this study also showed a decrease in HbA1c. Fasting plasma insulin and HOMA-IR were also significantly reduced, as was total cholesterol and LDL cholesterol that decreased significantly. So fairly broad impact on the digestive system. The unfortunate aspect of berberine is that it does have some instance of gastrointestinal adverse events. In this specific study that I'm quoting, it was 34.5% during the 13 weeks of the berberine treatment, including monotherapy and combination therapy. Diarrhea was 10.3%, constipation was 6.9%, flatulence was 19%, and abdominal pain was 3.4%. You will see the numbers on the slide next to it. Diarrhea was 6 people with a percentage of 10%. So these weren't particularly large numbers that the study was looking at. It was only in the first 4 weeks in most patients, and specifically only lasted for 1 week after a decrease in the dose. None of the patients suffered from severe gastrointestinal adverse events when the berberine was used by itself. So be careful what you're combining it with. this specific study was looking at combining berberine with a variety of other insulin affecting medications. So be careful what you combine it with, basically. Liver and kidney functions were monitored during that study for significant changes in plasma ALT and creatine. None were observed during the berberine treatment, which again was 13 weeks long, and no one showed pronounced or more than 50% elevation in liver enzymes or creatine. So case description, this particular person is 35 years old. They are female. They have the APO gene and a congenital mitral valve prolapse. They also have head and hand shaking following exposure to Strachybrotus chartarum and ochratoxin A, which they've been addressing using 2 tablets twice a day of gonmeling and 1/2 a 500 milligram L-tyrosine for the mycotoxin exposure. That was actually prescribed by someone else. On examination, they had pain in their pancreas. Given that pain has been a negative impact of berberine and the area was swollen and slightly red, the decision was made to move them away from that particular form of berberine. The tongue at the time was purplish in the center with pale sides that had teeth marks and a normal white coating. The pulse was slightly rapid and tight. They were changed from that original form of berberine, the Berberis aristata, grown in the Himalayas, to an extract from Oregon grape, actually the whole herb, which was grown in Oregon and thus somewhat closer to where they live than the Himalayas. There was a 5-day break between the Berberis aristata and the Oregon grape. They tried the Oregon grape twice and couldn't take it at all. They had an increase in the abdominal pain and vomiting within 30 minutes, at which point the decision was made to move away from berberine entirely. The tongue at that point was purplish in the center with teeth marks and a normal white coat. The pulse was rapid and tight. A 1-week break was taken before they started a food cleanse, which was not advised by me, it was advised by their doctor. And the food cleanse was specifically a vegetarian and low carbohydrate, given that they are an APO gene type. They do need a fair amount of meat. This food cleanse continued for 3 weeks. They did stop throwing up, so it did have some significant positive impact. They also became cranky, started dreaming about hamburgers, and eventually got shaky, at which point the decision was made to stop the food cleanse. At that point, the tongue was pale with teeth marks and a normal white coat, and the pulse was rapid and thin. Another 1-week break was taken, and then they were changed to turmeric, grown in a neighboring city. Turmeric has traditionally been used for gynecological problems, gastric problems, hepatic disorders, infectious diseases, and blood disorders. Cell-based studies specifically have suggested antimicrobial, insecticidal, larvicidal, antimutagenic, and radioprotective and anti-cancer effects. Animal studies have also shown potential against pro-inflammatory diseases, cancer, neurodegenerative diseases, depression, diabetes, obesity, and atherosclerosis. So again, there's an impact on the digestive system and on sugar absorption. It modulates numerous cell signaling pathways and, quote, in clinical trials, turmeric has shown efficacy against numerous human ailments, including lupus nephritis, cancer, diabetes, irritable bowel syndrome, acne, and fibrosis. Studies have shown that dietary curcumin specifically reduces inflammation, curcumin being the main extract from turmeric, though not the only active component. It also delays or prevents obesity-induced insulin resistance and complications, has impacts on atherosclerosis and immune mediation of liver disease. So again, fairly broad effects on the digestive system in general, but specifically affects sugar absorption. Quote, curcuminoid supplementation significantly decreased fasting glucose in this specific study, a HbA1c and insulin resistance index in type 2 diabetic patients. Curcuminoids also led to a significant decrease in serum total FFAs, triglycerides, and an increase in LPL activity. So again, fairly broad impact on digestion and specifically on sugar absorption. You can see how all of these herbs have differing indications, but overlay the same indications in this specific area. It also is an inhibitor of DNA methyltransferase and is considered a DNA hypomethylating agent, and quote, is able to restore the epigenetic regulation balance and appears as an attractive prevention and or therapeutic approach against human cancer. Not specifically an issue in this case, but an important thing to keep in mind. So when the switch was made to turmeric, given the issues in the previous herbal formulas, and this particular patient's history of developing issues with herbal formulas. They have a long-term history of developing issues taking herbal formulas, even when they were initially effective. The decision was made to change the timing and the method of delivery. This particular individual was switched to using turmeric regularly in cooking, so it's 3 to 4 times a week with food, and lowering the dose. So it's a more traditional dose for cooking as opposed to for an herbal formulary. This has been reasonably effective. They've not started any pain or vomiting back up since the diet cleanse. They've had improved and sustained weight loss, specifically 14 pounds in the past month. The tongue is currently pale with slightly swollen sides, but without the teeth marks, and a normal white coat, and the pulse is slightly rapid and thin. I have some references here. And does anyone have any questions?